The new recommendations will shorten the treatment for multi-drug resistant tuberculosis from the original 18 to 24 months down to 9 to 12 months. This aims to speed up detection and improve treatment outcomes for MDR-TB through the use of a new rapid diagnostic test and a shorter, cheaper treatment regimen. The new treatment also cuts the cost in half to about $1,000 per patient and could potentially reduce deaths among patients due to better adherence to treatment and reduced loss to follow-ups.
This is a critical step for the fight against multi-drug resistant tuberculosis that affects today 500,000 people. We believe that hundreds of thousands of patients will now benefit from these new recommendations.
The shorter regimen is recommended for patients diagnosed with uncomplicated MDR-TB and those who've not yet been treated with second-line drugs. The new recommendations on the shorter regimens are based on initial programmatic studies involving 1,200 patients with uncomplicated MDR-TB in 10 countries. WHO is urging researchers to complete ongoing clinical trials in order to strengthen the evidence base for use of this regimen.
WHO is working very closely with countries and with technical and funding partners to make sure that as quickly as possible countries implement and roll out the new technologies and invest the savings, especially on the short regimen, invested in accelerating the crisis response to MDR-TB.
Resistance to standard TB drugs exists in most countries worldwide and is fueled by inadequate treatment. Based on figures from 2014, WHO estimates that 5% of TB cases are multi-drug resistant, translating into 480,000 cases and 190,000 deaths every year. Leslie Marungu, CCTV.